Hi, my name is Tony Pillow. I'm a student here at Southwest. I'm going to be doing an assessment on you today.
Sorry.
And it'll be a neurological assessment. So I'm going to check the doctor's orders here. Is that okay with you?
Yes.
Okay. What's your name?
Josephine Smith.
Okay, Josephine Smith. And your date of birth?
October 5th, 1963.
Okay. Any allergies at all?
No.
Okay, very good. I'm just double check the name tag. Okay. We got the right paperwork, so that's great for the neurological assessment. I don't need to wear gloves for this, but I am going to wash my hands.
Okay.
And we'll provide a little privacy. So, we're going to start out, when I first start out, just basically looking, look general symmetry of your face, and your face is good, and I don't see anything drooping or anything. It's even on both sides, so that's great that way. And we're just going to kind of start top down and look a little bit closer at your eyes. So if I could talk you into taking your glasses off, that would be wonderful. Okay, so I'm looking at your eyelashes and eyebrows and your eyelids. Make sure they're kind of even from one side to the other. They are. If I could have you do this for me, please. Okay, these are your conjunctive. That's the inside of your eyelids. They're good pink. There's no sign of problems there. And lift up on them. Okay, good. And I'm also looking at the scleria, which is the white of your eyes. Looks really good again. So we're going to move on from there. The next thing I'm going to look at a little bit closer is your pupils. So I'm going to just shine a little light in your eye. It doesn't hurt or anything. Okay. Okay, good. Okay. Okay, good. So what I'm doing there is when I shine light in your eyes, your pupils constrict. And then when I pull that away, they dilate. But your pupils work together, so when they constrict and dilate. So when I constrict this eye actually constricts as well. So these muscles are working well together. Next thing I want to do is I'm going to have you watch the pen. And I'm going to move up here and back and here and back and down and back. And I'm going to come to the other side, lateral and upper left and lower left. Good. What I was doing there was a couple things. We're watching how your eyes track. They track well together. Your eyes are tracking well together. And we're also, I pause a little bit at the end of that to see if there's any flutter or anything in your eyeball, and there's nothing there. So the next thing I'm going to have you do is, I'm going to have you read this piece of paper here for me, close up.
Visual field test.
Okay, very good. You did get that. The next thing I'm going to have you do is I'm going to have you focus on this pen close up. And if you want to focus on this pen close up, I'm going to look at your eyes here also. Okay, when I pull this pen down, I want you to look out the window there, okay?
Okay.
Okay, very good. So what that is called, that's called accommodation. So when you're looking close up at this pen, your pupils constrict. When you look farther away, they open up to adjust for more light, and that worked very well. All right, so we did that. Good. All right, we picked on your pupils enough, so let's, we saw your ocular movements. Let's have you stand up for a minute. We're going to do what we call field of vision. So if you could just kind of mimic me. Okay, I'm starting down here with my pen light. Tell me when you can see the pen light.
Yes.
Okay, good. From the side.
Yes.
Okay, and above and down.
Yes.
Okay, good. Good field of vision. Do this side, from down below.
Yes.
Okay, from the side.
Yes.
Okay, top down.
Yes.
Okay, very good. Very good. All right, you can sit back down. Okay. So as your field of vision, you have good field of vision. So, done looking at the eyes for a little bit here. And we're going to look at your nose. And your nose, again, we start with a good symmetry in your nose. And look at the skin color is good. It's not larger, it's not red or anything like that. Are you having any problems with your nose at all?
No.
Okay. Could you just do this for me and see if you can get a good breath of air on the other side? Okay, good. So we're getting good airflow through your nasals there. I'm just going to look up your nasals quick. Okay, good. And look up on this side. Good. Nice and pink. I don't see any contusions or anything like that in there, any polyps you're worried about or anything like that? Do you have any concerns yourself? Or?
No.
Okay. So there is some hairs in there, but that's all part of your nasal system, and it keeps dirt from getting up into your sinuses. So I'm going to palpate your sinuses right now. These are your frontal sinuses. I'm just going to tap on there a little bit, and you tell me if you had pressure on there, if you feel anything or not.
No.
Okay, good. And your maxillaries.
All good.
Okay, good. So those are your sinuses. So they would be sore if I pounded on them and you couldn't you felt something there. So I think we're pretty good with your nasal stuff. So we're going to move down a little bit to your mouth area.
Okay.
Again, a visual on the outside. I don't see any cold sores even. I see good color on your lips. Could you pull your lips down? Good. So inside of your lips good. Your gums look good. Your teeth look good and up. And that's the same. It looks good. Gums look good. Teeth look good. Okay. I'm going to have you, if you would please, open up your mouth. All right, look at the back of your throat and your tonsils. They look really good. Your tongue looks nice and pink. That's all good. Can I have you stick your tongue straight out and move it to your left and then to your right? Awesome. Okay. So that's very good. So believe it or not, we have you stick your tongue out because some people, if they would have possibly some nervous issues or a stroke or something like that, they would have a hard time sticking their tongue out straight. Okay. All right, so that's all good. From there, I'm going to move down, and I'm just going to grab your larynx here. You give me a big swallow. Good. Okay. And you did say when I stuck your okay. We had a nice, good, smooth muscle come down through your esophagus there, so we know that that's working well. That's the way it should work, is it slides down for food and what have you. So that's working well. Next thing I'm going to be looking at is your ears. All right. So the first thing I'm going to do is palpate, which means I'm going to be touching your ears, your auricle, and we'll look back here. And I'm just going to pull forward on them a little bit. Is there any pain there or anything?
No.
Okay. I'm going to pull up on it. Okay. I'm going to put your, feel the sternal-mastoid back here. Nothing?
No.
Okay. Push on the tragus. Nothing? Okay. Excuse me, I'm going to pull a little bit on the tragus, and I'm going to pull on the pinna. All right. Same thing on this side. Auricle, I'm just going to pull back some. I'm going to pull forward on the pinna, push on the pinna, pull forward on the pinna, and then pull down on the tragus.
Okay.
And nothing. Okay. And your sternal-mastoid back there.
Fine.
Nothing. Good. So it all feels well. Excellent. Okay. Next thing I'm going to do is I'm just going to look in your ear. Normally I do this with the orthoscope, but we're going to do a pen light today.
Okay.
We're going to pull up on your auricle here a little bit, straightens out the canal, and we're looking at the tympanic membrane back there, and it looks good. If it was a child, I'd have to pull down a little bit to straighten out the canal, but on this side as well, pull up and I'm looking back at the tympanic membrane, and it's kind of nice. It's gray color, but it looks clean, or it looks good. And I can even see your a little bone there. It's protruding, and that's how you hear is that tympanic membrane hits that bone and it goes inside. So that looks good. So we've done your eyes. We've done your ears. I'm going to have you stand up, and we'll do some one more test on your ears for hearing.
Okay.
If you go over here, please. Okay. Do you hear anything on the right?
Yes.
Oh, excuse me. Okay, tell me what side.
Right. Right. Left. Right.
Okay, very good. You can sit back down. Okay, so that was kind of a whisper test for your ears. And your class passed that with flying colors, knowing which side to hear from. Okay. So we've worked on yours a little bit. Next thing is I'm gonna just kind of check around at some of your we're gonna check your occipital and your. I am going to check some of your lipids. I'm going to check some of your lymph nodes. Okay. So, we're going to go back here. This is your occipital lymph node. Okay. And we're going to have right back here, which is your post-auricular lymph nodes, your pre-auricular lymph nodes, your submandibular lymph nodes, your submental lymph nodes. Here we got your, let me find this one over here, superficial anterior cervical, superficial anterior cervical, and your posterior cervical. And then here, if you lift your arms up a little bit, this would be your supraclavicular. And they all feel really good. Okay, very good. I'm going through my mind. Don't think I forgot anything. Let's see, your eyes, we did range of motion, up, down. Your hearing, we didn't. I need to talk to you a little bit more about your hearing yet. And your eyes, we did. We did everything on your eyes. Okay. So, as far as your hearing goes, have you had any hearing problems?
No.
Is anything hearing run in your family, or any?
Not that I know.
Any like changes in your hearing, or any like ringing in your ears or anything like that?
No.
Okay, very good, very good. You do anything to protect your ears?
Sometimes wear an earplug.
That's great, that's great. I'm glad you're doing that. Okay, very good. Okay, so next I'm going to check you for gross motor skills. If you want to stand up, please. And if you could go foot to toe and take 3 steps that way.
Okay.
And turn around with your back. Very good. Okay. If you want to just stand over here, I'm going to have you close your eyes and put your feet together. We're going to do what we call Romberg's test. Okay, and while we're doing this, seeing how stable you are, most people are a little bit wobbly. Okay, you can open your eyes now. You can set back down. Most people are a little bit wobbly. Now, but you did fine. Your gait looked good. Okay, and we're just checking for gait when you walk back and forth. So that's all good. So those are your gross motor skills. Let's do your fine motor skills while we're thinking about motor skills. So if you want to just put your fingers to your hands, very good. So that's your fine motor skills. Okay, very good. So we're coming close to closer to the end of our what we're doing here. I guess I'll talk to you a little bit more about nerves. I'm gonna take your reflex in your foot, and I believe we will be close to Andy. Okay, so we did your gross. We did. Okay, so there's 12 major nerves that come, cranial nerves. First one is your smell, your olfactory nerve. Okay, and we haven't really tested that one yet, so we're going to test that real quick. Could I have you close your eyes?
Mm-hmm.
Okay. Can you smell this for me?
Lemon.
Lemon, very good. That's essence of lemon, so that's great. So that's your olfactory. That's nerve number 1. Your optic is your second nerve, and we've been checking that all along the way here. Third nerve is your ocular motor, and we've been checking that when we check range of motion and things like this. Your fourth nerve is your trochleal, and that is also tied to your eye movements. Your fifth nerve is your trigeminal nerve. Your trigeminal nerve is actually the feeling in your face. So we kind of been doing some of that, but we're going to just double check some of this. So if I could have you close your eyes, where do you feel that?
Right here.
Okay, forehead. And where do you feel this?
At the left cheek.
Okay, and here?
On the chin.
Okay, and here.
Right cheek.
Okay, very good. So you've got feeling in all your face. You don't have any concerns about not having feelings in your face or anything. So that's good. Okay, your abducens is your 6th nerve, and we've been doing a lot of that with our eyes. We've got your facial nerves, which I've been seeing you move around, and I feel really good about that, but we'll do it anyway. If you could blow up for me. good. And give me a big smile and a big frown. And I'm checking for evenness from side to side. That's good. And you've been doing really good that way. Okay, so facial nerve is good. Let's see, we've got the vesio, number 8 is the vesicocleal. That's the vesicocleal nerve. And that we've been checking, that's back by your, when we check your ears and your oracle out that way. We've got the glossopharyngeal, and that's the next nerve, and that is tied to your, it's in the back of your throat, and that's tied to your, in the back of the throat, last third of the tongue, your swallowing action and some things like that. We've got number 10, which is the vagus nerve. We checked that when you said ah. Okay. We got number 11, which is accessory nerve, which I've seen you do this before, but could you do that for me? Your accessory, your shoulders are an accessory to your cranium. And then we've got number 12, hypoglossal. Okay. And the hypoglossal is your tongue action or tongue area. So and we did that when you stuck your tongue out. Okay. So those are the nerves that we covered. Other than that, you know, you've been very cognitive. Your level of consciousness, I think, is very good. You've been, you know, talking with me back and forth. You've told me about your hearing and some things like that. So I mark you down as a positive level of cognitive. We do that throughout, and just kind of something that we keep track of. So that's all good. So you're checking out really good here. I think I've got one last test I want to do, the Babinski test. Okay, so because we've done fine motor, so, and what that is, I'm just going to check your reflexes in your foot here. Okay, and to do that, run this around the outside of your foot. Okay, and I'm watching for flex back in your toe. Can you see this on the other one? The outside. The outside of your foot, around the pads, and we don't have any of that back flex. Now, it would be natural to maybe curl your toes or natural to pull away because it tickles. But what's not natural would be to pull back. And actually babies do have that reflex, but they lose at a very early age, a number of months even. If an adult has that, sometimes it's a sign that because of some sort of nerve damage, they regress back into that state. So do you have any questions?
No.
Okay. I don't believe I have anything else for you today. You've been a great patient.
Okay, thank you.
And I'm just going to record this over here. And I'll leave you alone.
Thank you.
You bet.